Today we are going to look at concepts of prevention and control and modes of intervention. I am Dr. Ankita, and today we are why do we need prevention and control, and what is its importance in preventive medicine? What are the levels of prevention and what are the modes of intervention? I'll summarize at the end. So this is going to be a short presentation about concept of prevention and so as you know, community medicine deals with promotion of health, preservation of health, restoration of health when it's impaired, and decrease suffering and distress. So this depends on adequate knowledge of causation, dynamics of disease transmission, identification of risk factors, risk groups, availability of prophylactic or early detection and treatment measures. Okay, so it is not necessary that we know everything about a disease, but we need to know some parts of the natural history of disease where we can intervene. So this is not possible in non-communicable disease where they have variable latent period and the natural history of disease is not well known. So in that we have levels of prevention and modes of intervention, and that's what we are going to talk about today. The overview of the levels of prevention are primordial, primary, secondary, and tertiary. These are the levels of prevention. Under each of these levels of prevention, you have modes of intervention. Under primordial, you have individual education and mass education. Under primary, you have health promotion and specific protection. Under secondary, you have early diagnosis and treatment. And under tertiary, you have disability limitation and rehabilitation. So this is the summary of my class today. So we'll be dealing with each and every one of this. So we'll come to the first one, which is nothing but primordial prevention. So primordial prevention is a new sort of intervention which is added, and in its purest sense, it is prevention of emergence of development of risk factors in countries or population groups where they have not yet occurred. So this becomes very important in many of the non-communicable diseases which have early origins in childhood, like smoking, eating patterns, physical exercise, etc. So the main intervention is mainly given through mass education and individual education. Some examples of primordial prevention include sanitation and water safety in the prevention of foodborne and waterborne diseases, nutritional policies like Poshan Abhiyan, which is a nutrition mission, tobacco control by tobacco taxation, personal hygiene improvement in the prevention of trachoma, that is an eye infection, promotion of physical activity and improvement of physical activity in children or in by establishment of parks, amusement parks and others include primordial prevention. In individuals where the risk factor has already occurred in the population or the country, action needs to be taken prior to the onset of disease, which removes the possibility of disease occurrence. So this may be accomplished by measures designed to promote general health and well-being and quality of life of people, or by specific measures. So this includes the concept of positive health, and mainly this is applied in chronic diseases such as coronary artery disease, hypertension, cancer, based on the elimination or modification of risk factors. Okay, so these are done under two main strategies. They are population approach and high risk strategy. So what do you mean by population strategy? Where the strategies are ascribed to the entire population irrespective of their individual risks. Okay, so example, small reduction in average blood pressure or serum cholesterol would cause a large degree of decrease in cardiovascular disease. Okay, some others include universal immunization program or the fixing of the legal limit of marriage in the prevention of infant mortality rate, maternal mortality rate, and sexually transmitted diseases. Okay, high risk strategy aims at preventive care to individuals who are especially at high risk. Now, this requires people to be detected who are at high risk. So, uh, this can be done when we identify people and when we circumvent the risk factor. Okay, one example is iron and folic acid supplementation in children and pregnant women and adolescents. So the modes of intervention for primary prevention is health promotion, which is nothing but the process of enabling people to increase control and improve their health. Okay, so this is not directed against any particular disease, but it will help you to strengthen the host by variety of approaches. So these are the approaches. They are mainly through health promotion and specific protection. So health promotion, under this you have four main interventions, and under specific protection you have four main interventions. So under health promotion you have health education. This is the most cost effective intervention, and by giving health education, this we improve the health of healthcare providers, general public, patients, priority groups, community leaders, and decision makers. In environmental modification, you have a comprehensive approach which requires safe modality of provision of water. We'll talk about the examples in the next slide. Okay, so they are non-clinical approaches and have in the past helped in controlling many of the communicable diseases. Then you have nutritional interventions, which is food distribution and nutrition improvement, especially in vulnerable age group. Then you have lifestyle and behavior modification. Here, the action of prevention is by the individual and the community taking responsibility for their own health. Okay, so health education is the basic element of all health activity, and we give them health education to improve their lifestyle. Then you have specific protection. Specific protection is to avoid the disease altogether by immunization, supply of specific nutrients, chemoprophylaxis, prevention of carcinogens, avoidance of allergens, and control of other such environmental hazards. Okay, so this is how we intervene. This is under primary prevention. Look at a few of the examples. Under health education, you have various approaches like regulatory approach, where in the form of public health laws, we are going to give them health education regarding, for example, in the COTPA Act, which is prevention of tobacco. Yes. So what we do is that we educate people, especially school-going children, where they are very susceptible to develop such disease or such habits, which are precursors for many of the non-communicable diseases. So what we do is that we, through public health legislation or through laws, we infuse this health education. Then you have service approach. This is by providing services required, the service of health education in the PHCs. Okay, and you have primary health care approach. Here, primary health, through the provision of primary health care, okay, and the elements of primary health care like water, sanitation, RCH, locally endemic disease, we give health education. Okay, then you have environmental modification, that is through, say, like how we told you in the previous slide. A few examples include safe disposal of excreta, chlorination of water supply, and Few other interventions in lifestyle is including change in attitudes, personality development for management of stress, especially in non-communicable disease. It also may include yoga and meditation. Nutrition intervention, like examples include exclusive breastfeeding, micronutrient supplementation through. Okay, specific protection is, as I told you, to avoid the disease altogether. And however, it is not very it is specific for those particular diseases only. It does not provide a blanket. It is not a general term of protection. Like you have occupational health, you have all of this equipment that is only for that industry. By wearing this personal protective equipment outside this area, they do not prevent any other disease, right? So vitamin A supplementation in prevention of or reduction of gastrointestinal and other mucosal diseases, mucosal systems or mucosal diseases. You have personal hygiene, immunization, supplementation of iron and folic acid, especially in pregnancy, children, and okay. So next you have secondary prevention. Secondary prevention is the action which halts the progress of disease at its incipient stage and prevents complications. Okay, the specific interventions include screening tests and chemoprophylaxis or adequate treatment. Okay, so by early diagnosis, secondary prevention attempts to arrest the disease process and restore health by seeking out unrecognized disease and treating it before irreversible pathological changes occur. It may also prevent other people from developing disease. Okay, so they are mainly through early diagnosis and treatment. So it's done by screening. Yes, so screening will help you in earlier recognition of the disease, and it can be described as stamping out the spark rather than calling the fire brigade to put out the fire. Okay, so these intercept or oppose the or dissipate the action of the pathogenesis phase caused due to the agent. Okay, so they either cure or arrest the disease and prevent prolonged disability. So as I told you, early diagnosis is mainly to prevent the complication. You detect them early and give them treatment early so that there won't be any pathological changes will not occur further. Okay, some of them are used in cancer screening. They are called as 8 danger signs of cancer. Pap smear or self-breast examination can also be added as screening interventions for cancer. Growth monitoring also is an intervention tool where you are going to monitor a child's health and see whether it is faltering. Okay, treatment, you have mass drug administration for filariasis and correct treatment course of TB, which prevents multi-drug resistant tuberculosis. So then you have tertiary prevention. Tertiary prevention is when the disease has advanced beyond its early stages and it is still possible to accomplish prevention by intervening in the late pathogenesis period, which is defined as all measures available to reduce or limit impairments and disabilities and promote patients' adjustments to irremediable diseases. Okay, so this is mainly to prevent morbidity or sequelae. Okay, so how do we do intervention? Include disability limitation and rehabilitation. So disability limitation is where, because of there are three concepts, there is disease, impairment, disability, and handicap. Okay, an impairment is nothing but loss of or abnormality of psychological, physiological, or anatomical structure of function. Because of this impairment, they are not able to carry out certain activities, and if they are not able to carry out these certain activities, they will not be able to lead a social and economical productive life, which is called as handicap. Okay, so this is disability prevention, where you reduce the level of impairment or by giving appropriate treatment or preventing transition of disability to handicap. Okay, that is mainly done by rehabilitation, which is defined as the combined and coordinated use of medical, social, educational and vocational measures for training and retraining the individual to reach the highest possible level of functional ability. Okay, so all measures which are aimed at reducing the impact of disabling and handicapping situations are used, and by doing this rehabilitation we achieve social integration of a patient. Okay, so that's where many of you as physiotherapists come into picture, where you're going to rehabilitate this patient back into health. So this is the summary. So you have 4 levels of prevention: primary, primordial, primary, secondary and tertiary. Okay, and for each of these you have 2 types of intervention. For primordial you have individual and mass education. Under primary you have health promotion and specific protection. Under these 2 you have 4 each. So under health promotion you have health education, environmental modification, nutritional intervention, lifestyle changes, and specific protection you have immunization, chemoprophylaxis and changes in the environmental hazards or reduction of environmental hazards. In secondary you have early diagnosis, that is done by screening and prompt adequate treatment. Tertiary is by disability limitation and rehabilitation. Rehabilitation can be on various levels like medical, vocational, social and psychological.